I'm Tatiana from the Human Services Department, and this is the last day of Social Justice Week. We have closed captioning services are available in the chat box. So if you need that, just click on the link. Tonight, we're going to be talking about this is going to be a briefing on the housing and homelessness in Charles County during the COVID pandemic. And we have Sandy Washington here. She is the director of lifestyles, and she is going to discuss the current state of services for the homeless in Charles County and how the homeless population has been affected by the pandemic. She has been working for 30 plus years in the community with the homeless population, and she is a long time social justice presenter, advocate, and inspires students and volunteers to give back to their community, to those in needs. In 1998, she co-founded Lifestyles of Maryland Foundation, whose mission is to empower people and assist in providing a better quality of life through social awareness and community development. Although the organization is located in Plata, Maryland, assistance is provided to residents throughout Southern Maryland, Washington, and the organization has been recognized throughout the state of Maryland for their dedication to serving those who are homeless, from street outreach to more permanent housing initiatives. So I am going to turn it over to Sandy Washington, and thank you so much. She has always come to the college to present for us, but now more than ever, we need to find out what we can do to help the homeless. So Sandy, would you like to start?
Let me unmute. Thank you so much, Tatiana. I appreciate the invitation to present this evening. I like the idea of being able to reach out to as many people as possible in the comfort of their homes, hopefully. And this is a good opportunity. This is really kind of moving to me to be able to share some information on homelessness and the plight of the homeless in our community. And so I want to start off by telling you a little bit of the services that Lifestyles provides for those of you that may not know that. Erica, next slide, please. First of all, this is what we're doing now and what we've continued to do for over a year into a pandemic. We provide 24/7 non-emergency on-call services, which means that when our offices close at 5 o'clock and in La Plata, our phone is answered at the Fuller House in Waldorf, and staff is there 24/7, making sure we can take the calls from folks that are in need and being able to link them to available services. We have continued even during a pandemic, and I can only thank our outreach staff and volunteers. And at a time when people were feeling that they weren't feeling comfortable going out into the community, our outreach team was still going out, doing outreach every week, going to encampments, going into parking lots, going into places where we knew people were inhabiting locations that probably shouldn't have been inhabited. And they went out to do wellness checks, to provide PPEs. Even in the beginning, I hope many of you realize that most of us couldn't even get PPEs in the beginning. And so when you're looking at protective equipment going to folks that are living outside, this was really important for us to see that we got that. And so in many cases, we found it in other places, we purchased it and made sure we got things out to folks that were outside, getting them masks, getting them coverage. When you don't have running water, working with the county to put in sanitation stations where people could go to the bathroom and wash their hands. And this was crucial at a time when folks were talking about make sure you stay isolated and make sure you wash your hands. Well, if you're homeless, where are you going to stay isolated and where are you going to wash your hands? So our street outreach team continued to do that. In March of last year, the beginning of March, we put our homeless hotline in place. The text messaging ability to be able to get out to everyone that we had made contact with that had a telephone. It allowed us to not only text them, it allowed them to make calls, text us back to say that they needed things, to do wellness checks, to let us know where they were, whether they've moved from one location to another, what they were in need of. So it allowed for that constant connection with that population. We also provide emergency transitional housing. I know many people have heard about, they talk about the Safe Nights program, the hypothermia program that we offer for the county, working with the different churches throughout the community where churches have worked to house folks this year. And I'll tell you a little bit more about that later on in the presentation of how we had to adjust because of COVID and dealing with churches and how they were able to assist us through this process. And then getting people their vital records and vital assistance. If you don't have a birth certificate and you don't have other things, how do you get connected to resources and services that you need? So being able to get those vital records for folks, the things that we take for granted. We do housing searches. If you're homeless and trying to find out where you're going to go, what you can afford, what's available. So we have staff that we do the housing searches. We maintain a housing list, seeing for rooms for rent or available housing that may be there, but I'm telling you that's limited. And so a lot of it is really working at encouraging landlords and independent folks to look at housing options for folks. Our food and clothing, we kept that going. We weren't able to take in clothing for a while, but we were still able to distribute it as we did outreach to folks. Also offering financial assistance, people that are in need of rental assistance or emergency assistance to pay for utilities and other things, we're able to do that. I tell people we did everything from, we've even during this pandemic have assisted in paying for funeral expenses and working through that process, and newborn babies needing assistance after deliveries in the hospital and needing help with clothing and getting other things for them. So we do really work from the cradle to the grave in most of these instances. We provide case management in all services. And then we have our domestic violence and safe housing. We have 2 domestic violence homes and then the transitional housing. And then some of you may have seen our transportation on the road. We have our buses that run taking people to and from appointments. We not only do the Southern Maryland area, but we are also in Washington and Virginia where we're taking people back and forth to appointments, which is really crucial when people have children and have to get from one place to the other. Some of the things we've had to do for COVID during this time with transportation is certainly retrofit our vehicles so that we could put up plastic dividers between seating and being able to reduce the number of passengers on a vehicle as we go through this process. And then, of course, we make referrals to other agencies. And what we try to do is a soft handoff to those other services. Sometimes people say, what do you do? And I said, it's easier for us to talk about what we don't do than what we do, because we really try to look at the gap filling services that the services that don't exist in our community, and how do we fill those gaps. Eric, I'm ready. I think when we start talking about the data and we start talking about who are we talking about when we're talking about the homeless population, and many times people go on the point in time. And the point in time is a national count that HUD had put in place for years that actually counts our homeless population in every area it's usually the 3rd week in January that this count takes place. And it's taking place all over, or the last week in January. It takes place all over the country. And it's a snapshot of our homeless population at that time. So part of the point in time this year, what was different is normally we have hundreds of volunteers that actually cover the entire county. And we go into woods, we go into locations that we have actually documented throughout the year, and we're able to meet with folks that are homeless. We provide things to them that they need. We provide gift cards and blankets and other things to folks. But during a pandemic, that changes. And that change did not allow us to recruit and utilize all the volunteers that we normally do. So at this time, this year, we actually looked at a minimal number of volunteers, but mostly staff and folks that worked at DSS and other places that we went out together during point in time. And we did it over a week's time and captured as many folks as we could. I will say that that did not prove to be as advantageous as it is when we were able to cover the whole county in one day. And so we'll see the results of that will be posted soon, but we don't expect that data to be as fruitful as it was in years past. But if we look at data based on the homeless population, and all of that is put in our homeless management information system. So anybody that deals with homeless services is inputting that information, which is supposed to give us real time the number of homeless in a particular area. Whether it does or not, it depends. If you don't put all the information in, you're not going to get that information out. So it relies heavily on those providers to make sure all the information is put in a designated time frame. So just to give you the numbers from the previous point in time, and we'll show that on the next slide. So if you look at in 2020, next slide, please, Eric. In 2020, and I hope you can see this, and I know this is being taped and this information is there. If even during the taping, if you don't feel that you have most of it or can't really see it, we can provide that information on our website, or we can provide it to you, and the college can get that to you at another time. But you'll look at these numbers of these numbers in 2020, which is January of 2020, we showed 399 homeless individuals. And I'm going to explain to you a little bit about how these numbers are and why they're so low, and why I can relate this to children in schools and other locations, so you can see how these numbers are relevant. So of the 399 homeless individuals, you'll see 152 of them were unsheltered, meaning on the street or living in cars or places that are uninhabitable. And 247 of them were sheltered. So they were either in, transitional housing, Angels Watch, and Lifestyles housing in these areas. 26 children were unsheltered, and 126 adults were considered unsheltered. And you see the children, 70 sheltered and 177 adults. If you look at the total homeless per county, of these 399, Calvert County had 70, St. Mary's County had 76, and Charles County had 253 of that 399. That's a considerable jump from the other counties, looking at the number of homeless that were just shown in this point in time at that time. So if you look at the next slide, and you look at so many times people, they did a national announcement in 2020, and they talked about how homelessness had been decreased in 2020. Well, probably across the board, it may have, but if you look at our 2019 numbers and our 2020 numbers, our 2020 numbers increased. They did not decrease. And if you look at what the point in time indicates, they're looking at HUD's definition of homelessness. That means that even if someone stayed in a motel, but they paid for it themselves, they could not be counted as homeless, even though they wouldn't be able to pay for it another night or some other time. But at that snapshot, they paid for it themselves, so they're not considered homeless. Now, if an outside agency or someone else paid for it, they could have been considered as homeless. If someone were couch surfing, the language that's being used, you let them stay at your house tonight. We have children we have students at the college, we have students in public schools that family members or other students allow them to stay at their home for a night or two, realizing that the person didn't have a place to stay or thinking that they're just allowing them to stay, not knowing they're homeless. But that person couldn't be counted because they were in someone's house and they had a place to stay. So they were couch surfing. They are not counted. So this causes a difference between the number that we say are homeless and what our point in time may indicate. If you think about it, at different times, our public schools in Charles County are registering or are indicating that we have 600 homeless children in Charles County Public Schools. Well, you say, how do you have 600 homeless children and yet you only have a total of 399 homeless people in the entire Tri-County area? Because how they're indicating that they're homeless, the definition for homelessness is different from public schools than it is for what HUD is asking. Public schools, and I won't go into McKinney-Vento, but it goes into a different, as I say, eligibility for homelessness there. For us at Lifestyles, if you do not have a permanent residence, you are homeless. And so how do we help people have a permanent residence? And that's what we look at as the homeless population. And here's some additional trends and data, and you'll see in the next part. And then I want to talk about how this whole pandemic has hit us in so many ways. You'll see in FY 2019, we had 1,063 homeless clients served. And that was according to Department of Housing and Community Development's report. The report should be published now. At this time, when I originally started this, the report hadn't been published. At that time, we also had 13 active encampments in Charles County. And those encampments could have anywhere from 3 people to 20, 25 people. And encampments, most people know about the one behind Walmart and other places, but we have encampments throughout our community, and they are based on, just like most communities, the population is built upon the makeup of those encampments. You have some encampments, where there's no drinking, no alcohol, no drugs, nothing is taking place because people have moved away and they want to be away from all of that. You have encampments where families have gone, and we visit them, but they don't want people to even know they're there. And so we visit and we leave things for them, and we try to connect with them, but we don't want them to be afraid of staying where they are in case they need something. And so, those encampments are mostly families, and they're trying to keep their families intact, and many of them that we dealt with have been short-term, where they've lost their housing, they're there, they're trying to get on their feet, and they're a little bit afraid of what's going to happen because somebody knows they're homeless, they have children, and they're afraid of getting their children taken away from them, which is a myth. And so, we try to break that as we go through this process. So we have various encampments throughout our community. Also, we've talked about emergency shelter and transitional beds. We have 72 beds in Charles County, 72 transitional shelter beds in our county. And then at this time, we had 465 school-age documented homeless children. And of course, with the pandemic, getting children recertified as homeless and all of that, is that there's a barrier to some of that at this time, in addition to everything else. In our street outreach, those that were literally homeless from March to November of 2020 were 108 households and 154 individuals. That number has stayed that way through March. I just did March's of this year's numbers, and that number is still, you'll see in 2021, it's still close. We had 59 households, only because we've reduced the number of people in congregate setting and safe nights, and 112 individuals. And then we provided bed nights are a night that each person stays in one of these safe nights beds. We provided 4,447 bed nights. And we have estimated between 1,000 to 1,500 individuals with no permanent address. These are people that are couch surfing and doing some of these that don't have a permanent address, no location where they know that they're going to lay their head tomorrow. So then we talked about some of the other things that we have. We work with a coordinated entry process where we work with shelters. We provide rapid rehousing, homeless prevention, and permanent supportive housing, and we coordinate that with our partners throughout Southern Maryland. We have a strong connection with Department of Social Services. Our staff works together 24/7. The on-call staff works with social services and law enforcement as we get people in the middle of the night that are having a crisis or finding that they don't have a place to stay. And then we coordinate with these agencies to lessen the duplication of services. And we continue to have ongoing meetings with the hospital, the health department. I was glad to know that Dr. Abney had been on with all that's going on. We have worked very closely with the health department, especially during this pandemic, and with the public schools to make sure that we're meeting the needs of those children. Because while schools and other things close on the weekends, community organizations are open. Our faith-based community, we're after hours and we're weekends. And so it's important that there's some continuity in the services that we are able to provide. And then, I'll talk about some of the challenges that we've had. This housing search and placement, I mentioned that it's limited. Any of us that have looked at housing in Southern Maryland, especially in Charles County, if you are working in Charles County and trying to live in Charles County, affordable housing stock is very limited. And seems like nobody wants affordable housing. I'm not sure why, but the same people that we have that are working in our grocery stores and our laundromats and our dry cleaners and all of these places, they need a place to live as well. The people that work for nonprofits, we need a place to live as well. And so affordable housing stock has to be looked at. More housing search and placement services are needed. And then working with landlords, we need to look at some of the income requirements. And there are many landlords, we have folks that are out there that need help with third parties paying for security deposits or first month's rent to get people started and on their feet. And there are a lot of landlords that don't want third parties payment because they figure if somebody else has to pay, what's the likeliness of you being able to continue your payment? But these third party payments are taking people from possibly homelessness and employment to getting on their feet and sustainability. So we need to look at that and some of the Housing First guidelines. And some of the other things, and you can see, we talk about the perceived notion of shelter beds are not needed in our community, and they're certainly needed. And then looking at racial equity challenges for persons of color to receive services. And when I thought about this, when we were looking at social justice and other things, many times people think about the folks that are homeless and the idea that they have of who is homeless. And, you have people thinking that folks that are homeless, they're either, they're on drugs, they're alcoholics, they just don't want to work, I can tell you, we can break that myth over and over and over again. We have people that are working 2 and 3 jobs and still can't find a place that they can afford and to stay, to put a roof over their heads and their children's heads. And many times, what we've seen is there is some inequity when you're talking about racial disparities. And I know that's a lot that's going on right now with dealing with that and equity challenges. But it's not just in employment and other things. It shows up when you're talking about homelessness as well. And so I know the state of Maryland will be looking at this more closely, looking at equity in housing and looking at equity when it comes to services to this population. And I just hope that we take a closer look at that in our communities as well as we look at moving forward with working with people. One of the things I want to raise as when we were talking about this pandemic, it forced us in March to shut down our Safe Nights program early. And it forced us to do that because many of the churches, and we don't fault them at all, they didn't know what was happening with this. And if you can imagine, they're having to stop their church services, and yet we're bringing in folks that are homeless and they're not knowing what's going on. And here's this pandemic. And how does the leadership explain to a congregation that you're not opening it to a congregation, but yet you're bringing other people in, you're not sure of their conditions and all of those things. And so we had to look at what the CDC was recommending and reducing congregate shelters. And so it was a very hard decision for us to stop the Safe Nights program, because in all honesty, where were people going to go? We then we housed as many people as we could. We sheltered people temporarily in motels, but ultimately we didn't have an answer. So the only thing we could do, as we said, worked with the county to put in emergency sanitation stations and trying to make those that were living outside as safe as possible. But this has been a really trying time, because when you talk about advocacy, while people are trying to protect their families, while people are trying to see what needs to happen for themselves, here we're trying to do that, but we're still yelling out and saying, hey, there's a group of people that they don't have any place to go. There's a group of people that we can't close right now. We can't close down every government building. We can't close down every business and leave people out there with no access to anything. There's a group of people out there that we can't forget. And I found that I felt like I was out there hollering and feeling like somebody's saying, what's that crazy lady yelling about now? But, we had to keep fighting for a population and recognizing that all of us deserve the safety and health and safety that was afforded every resident of this community, whether we had a roof over our heads or not. And so this has been the challenge. It's been the challenge to keep working with folks, to work with folks that may not even believe that this was a pandemic. And I can tell you over and over again, our outreach team ran into folks every time saying, well, we don't believe this is true. This is just a conspiracy. This is, and we're saying you may believe that, but we need you to put a mask on. We need you to, if you want us to be here, you got to protect yourself and we have to protect ourselves. And so we need you to do that for us now until we figure this out. I think it's a major milestone to have gone from people not believing in this to us working with the health department to vaccinate and test hundreds of people over the last 3 months. This has been an unbelievable movement to see this taking place. and seeing our folks in the first round of people being tested, the first round of people being vaccinated, because all of us know if these folks are not vaccinated, they're going into our restaurants, they're going into our stores, and they need to be safe, not only for themselves, but for the people that they're around. So as we talk about, social justice, and we talk about what can be done, this is a fight that can't stop now. The pandemic has brought it to light. The pandemic has brought to light the fact that there are folks out there that are unsheltered. We have a project that we're doing, and you'll hear more about it in Nanjamoy, where we have 72 homes without indoor plumbing and running water. Those folks are essentially homeless. Many are in homes that should not be inhabited. And until we get running water or water to them, we've been delivering porta pots and sanitation stations to that community, and delivering water every week to that community, and working with those families. And hopefully you'll hear more about that, and you'll see the change that's taken place as a result of that. But we all have a job to do, and no matter how small you think it is, it all makes a difference. So I'm ready for any questions. I hope I've shed some light on a few things here. And we have some opportunities, and these are things that we have there that we've listed. We need to really look at housing vouchers designated to our homeless population. I don't know why we don't have that more. We do have some SAFA vouchers, but they're very few. We need stronger private and public and private partnerships. And we need to recruit housing folks that will get tax credits to put some housing and set aside for our homeless population. We can't keep sitting back and saying what we won't have happen. We've got to make some changes in our community. And then we have to direct a good bit of this CARES Act funding, which I'm proud to say is coming the way of many folks in the county, hopefully soon, to take care of some of the rents and mortgages and hotel stays. So hopefully that's a little bit about lifestyles and where we are now. Okay.
We have a question. The question is, it just hopped on me there. Are you accepting donations again now? If so, what kinds of things do you need, and when and where are donations accepted?
Okay, so it will be published. We're starting to accept donations. We're going to accept donations 3 days a week. What we're asking people to do, and I hope you can set up our telephone number, because we're asking people to call in for their donations, and if you can put it in the chat, it's our 301-609-9900 extension 205. And the reason we're asking people to call, we have limited space. And if everybody brings in 10 bags and all of that, we have no way of going through it. We don't have the staff to go through it. And then we have to be able to make sure we're controlling what we're getting in. I still want to protect the volunteers and staff that we have here. The types of things we're taking: clean clothing. We cannot dry clean. We can't take the expense of doing that. Men, women, and children's clothing. Work clothing, and everybody doesn't wear, and I don't know if anybody does right now, suits to work and those types of things. But we have people that wear khakis and jeans that they need those types of things for work too. So we'll take those types of things. We are not taking household items right now. I have nowhere to store them. We will begin to take those things because we're needing them for Southern Crossing and for the White Plains shelter that we hope will be opening in the next 2 months.
So quick question. There's an event, I believe this weekend, where food is getting handed out by Lifestyles.
Yes.
How often and does this take place, and where does it take place?
So we are, it's taking place at our office in La Plata, 101 Catalpa Drive. And I think we're 10 to noon. I'm sorry, I didn't have it right in front of me. It's 10 to noon, and it's drive by. So people come through, our volunteers place everything in your trunk, and you can just keep going. We're not asking you to stop and take names or do any of that. We just want to get food to the folks. And we're trying to do this monthly, and we post each time we're doing it.
Mhm. Daniel Carter says, thank you for giving this presentation. Calvert has had a similar problem with getting shelter beds for the homeless population. Thank you for taking so much time to help the vulnerable population that always seems to get left behind. So that was from Daniel.
Thank you, Daniel. And Daniel, you'll be pleased to know that we are in Calvert County. We have a partnership with Calvert County government where we are doing homeless services in Calvert County. Unfortunately, we're dealing with some property that is closed and left quite a few people homeless there right now, and we're trying to adjust to that. We will be, our Calvert County office will be in Prince Frederick. We're going to be partnering with On Our Own, and we will be there, but we are currently providing services there. We're proud to say that with Calvert County government, we have administered over $130,000 in rental assistance to Calvert County residents in the last couple of months. We provide transportation in Calvert County, and don't tell Charles County, but we really love Calvert County. So thank you, Daniel.
Another question. If we become aware of somebody who is housing insecure or homeless, where should we direct them first, lifestyles or social services?
So if the system works, and sometimes it does, either way you direct them, they will get to the other agency. If you come to Lifestyles First, we also, while we take the intake and we provide that, we do recommend that a referral go to social services. If you go to social services, they will refer you to all agencies that may be able to provide housing. So they may say Angels Watch and Lifestyles and Three Oaks Center, which is in St. Mary's, but they refer to Three Oaks Center also because Three Oaks has services for veterans and tri-county services. And so if you get the referral from social services, it will come to all of us. And so many times that is the best way to go because it'll come to us anyway. If it's an after-hours call, but you're not looking for after-hours shelter, Lifestyles is open, so you can make that referral to us, and then we will connect with social services also.
So Jonathan has a question and some comments. Some of the most resourceful and hardworking people I know are homeless. It is not a moral defect. I have two questions. Where do you get your funding? And can you speak of the differences in shelter opportunities between men and women, specifically single men?
Yeah, well, so Jonathan, let me start with the funding piece. Most of our funding is grant funding. Actually, until this year, our donation funding, private donations are a larger part of our funding currently, but most of the funding is grant funding. And unfortunately, we get federal grants, state grants, and local grants. Unfortunately, many of our grants are pass-through money. And so if we receive a grant for rental assistance, I may get a $50,000 grant for rental assistance. 5,000 of that money may be for us to pay for the services, like, supplies, staffing, all of that. The 45,000 is going to pay landlords. So while it looks like I've got 50,000, I really got 5,000 because I'm paying directly to landlords the rest of those dollars. So again, private funding, I would say 65% of our funds are coming from grants, federal, state, and local grants. Regarding available shelter, the Fuller House in Charles County is the only housing that's available for men, which is, most of you will know, it is always full. It is always at capacity, and always has a waiting list. And to me, that means you pretty much don't have any shelter. Because if that's the option you have, other than when Safe Nights is open, that becomes another option. But that's in at 7, out at 7. And so if you know you come in at 7 and you've got to leave at 7 in the morning, how restful are you? Because you hope you have a bed the next night. And this year we did something different where we actually signed people up for a week instead of people having to call in every night. We also worked this year and had one of the local motels renovate 10 rooms because we did not want people staying in the rooms as they were. So they renovated 10 rooms that we booked for the season of Safe Nights, that we put families in those rooms so they didn't have to leave every day and they could stay in that room for at least a week. In most cases, they stayed 3 weeks to a month in those rooms. But I can tell you that was very costly because we were paying close to between $16,000 and $18,000 a month to house different people during that time of Safe Nights, and that becomes very costly. We have been working on the shelter in White Plains for over a year, changing the laws to allow us to have a shelter in a light industrial area. But also now we had to change and modify the entire building, and finally got down to right now the sprinkler system, which I'm hoping is going in the next week or so. Once the sprinkler system is done, we have about a week of wrap up, and then we can start getting our inspections for our use and occupancy. That shelter will be available for men, women, and children, allowing us to not only have the shelter, but have a day program where we can work with folks and other agencies to provide wraparound services to hopefully get them transition to more stable housing even faster than coming through a Safe Nights program where you're in and out.
There's a statement and also a question. I had recently moved to Yuba County in Northern California. Yuba City and Marysville have a very large homeless population. I had noticed that it's not uncommon for people to have dogs. I was wondering if anyone has experienced people turning down help due to having an animal, or if there are any temporary animal fostering programs available.
If I didn't know better, I think you had a microphone or tape in my office. Yesterday and today, we have been exploring opportunities for sheltering of animals because we do have people that turn down housing because they don't want to leave their pets. Even when we've set up arrangements for their pets to be sheltered for a short period of time. I've likened it to somebody saying to you, I could put you up, but your child can't come. And maybe all of us don't understand that, but I've come to understand that an awful lot. When that's all you got, and this is a part of the family, you don't get to leave your family behind so you can put a roof over your head. And so we are exploring that. We're exploring what type of facility, what we could do to allow people to be able to bring their pets, and actually having a location that is explicitly for that, because of not only allergies, but also because we are in churches and it's not our place. And even in the White Plains shelter, it's the property owner. So we are really looking at that. And that is a really something. I know some people have seen, if you live in La Plata, there's a lady that we've worked with, and she's there with her dog, and she's not leaving her dog. Oddly enough, I've had people that want to take the dog, but nobody's asked about taking the lady. So it's always a challenge to us, but she will not leave her dog, and I understand that. We have worked with a couple of hotels that we've paid the additional fee. They've had a pet fee, and so we've paid the pet fee to allow people to stay at the motel and bring their pets with them.
Mhm. So we have another question. How do we reassure families that they're not at risk of losing their children if they're in need of services?
It's got to be that dialogue. And, homelessness does not mean that you are not caring for your family.
Mhm.
You can seek assistance. I can tell you, folks that have been homeless, that have had their children taken away, it's not because they're homeless, and it's not because of anything other than the care for those children. And any one of us would have done the same thing had we witnessed some of the things that have transpired. Homelessness is not that. Not having a roof over the child's head is not that. Looking at other services, looking at what can happen and being put in place. And that's why it's important to be consistent, to be able to gain the trust of the people that we're working with, to know that we're advocating for them. We're advocating for them and their families and trying to find the best way to help them. And to put in place what's better for them and their children. So even if it means we have to find a way to put you in a hotel for a period of time to get you settled, that you feel more comfortable working with other agencies to put in place what you need, then that's what needs to happen. But it's done on an individual basis. We can't say blanketly, because if a child is in danger and is mistreated, that is why children are taken away, not because they're homeless.
It's a statement. So many people are just a paycheck or two away from not being able to pay their rent or mortgage. The cost of housing in Southern Maryland is particularly concerning, especially for those who work minimum wage jobs.
Mhm.
Absolutely, and I think I've said that. This not supporting affordable housing, we got to break this. This is, I don't know how long we think that is going to be acceptable, and what language do we have to use to make it something that people can swallow. And that's what it comes down to. So you can't swallow affordable housing. You can't swallow workforce housing. Tell me what's palatable. But people need shelter, and we have to find a way to provide that shelter for folks. Additionally, I want to share, that point of people not their paycheck away. One of the things I think it's important to look at in some of the services that we put in place is that some of our financial assistance looks at how do we keep you from falling off the cliff. So many of the services and benefits are for people that have fallen already. And so, you can't get help with your utility bill until you have a cutoff notice. You can't get help with your rent until you have an eviction notice. But what about the folks that are hardworking, that have been trying to pay their bills, that have been trying to keep doing this, and they don't want an eviction notice, and they don't want a cutoff notice? But if they can get somebody to work with them, help them through where they are so that they don't fall off, that's where we have to also look, not waiting for people to fall off the cliff. So we want to talk to the folks also that I'm at the edge here. This is what's happening. I just fixed my car and I don't know how I'm going to pay my rent and buy groceries. Okay, maybe we can help you with the groceries. Maybe we can help you with something else and being able to do that. So you have to be able to go to people and have that conversation before people get too far gone. And now we're trying to kind of pull them back up after they've fallen off this cliff.
So Mark has a question, and I just lost it. Here we go. If we know someone is couch surfing, should we still refer them to Lifestyles?
Yes.
Okay. And Jessica says, does the gentrification of Washington, D.C. affect the homeless population in question?
Absolutely. The push is the push. People are coming from Washington, and some of them are landing in Prince George's, but not many. They just they kind of skip over. I think Prince George's kind of keeps the push moving, and they end up here, and then depending upon what the services are, which is challenging because there are more services in Washington D.C. and more services in Baltimore certainly than we have here. And so when we see people that are moving this way, our services are limited. And, we're trying to serve the residents that are here in Charles County first and utmost, especially in places like the Fuller House, which is a county-owned building. And so we have to look at serving that population. But to answer your question, yes, it has an impact on people moving this way.
We have 2 domestic violence questions. Are domestic violence shelter services available only to those physically abused or to those who are emotionally/mentally abused as well?
Yes.
Okay. And
Yes.
do you still have an office in St. Mary's also where the DV shelters are, domestic violence shelters?
Our domestic violence shelters are in Charles County, but we serve St. Mary's County as well.
Mm-hmm.
And yes, we do have the office in St. Mary's. Our St. Mary's office has been closed. The St. Mary's staff has been working virtually, but the office will be opening next week in St. Mary's. So yes, we are there. We are at 21815D, 3 Notch Road in Lexington Park in St. Mary's County.
So this might answer the next question. I provide drug treatment services in St. Mary's County, and a large portion of our population is homeless. The county government did a reasonable job at expediting housing during the pandemic, but there's still a large population that lives lawfully in tents provided by the county at Lancaster Park. Do you provide any of those services in St. Mary's County?
So we work very closely with the local homeless coalition. And in fact, I was just elected the vice chair of that coalition for the region. Mm-hmm. And so we work very closely with Three Oaks Center, which is taking the lead on what was happening in St. Mary's with the sheltering of folks there. Maria Scott, who led that charge for that endeavor, she heads our shelter and staff. She's our shelter supervisor here in Charles, and she is very well connected with the St. Mary's Services for Homelessness there, and as well as working with Three Oaks. There are a lot of funds available right now to help rehouse folks in the region, and especially in St. Mary's. So able to do some rehousing and helping people get established there. So I want to make sure, if folks don't know it, and if you're working with behavioral health clients, that you connect them. If you can't get through Three Oaks, please contact us. We'll certainly make that connection.
The last question that we have is from Adrian that says, how do I volunteer?
Oh, I love you, Adrian.
And how do I donate? And do you take checks? Those are all the last questions.
Yes. We take checks. You can go on our website. You can do all of that. You can designate where you want your funds to go. If you want it to go particularly to serving the homeless population, if you want it to go to, as I talked about, Nanjamoy and getting water to folks and doing that, you can certainly do that. And you can mail your checks to our La Plata office, and I'm sure you'll put it up, but that's at P.O. Box 1794, La Plata, Maryland, 20646. And donations are certainly welcome. People willing to volunteer. I want to say personally, during this pandemic, I've stayed home 1 week out of this pandemic, but every day I'm here in this office from at least 9, sometimes 9 to 9. Looks like tonight is going to be another 9 to 9 night, but I'm here in the office. The staff is here, volunteers are here. We're always needing volunteers to put together our outreach packages. We do groceries every week to families, so we're putting together grocery bags, getting food out to folks with toiletry bags, getting that out to folks, coming in to make some calls to people just to check up on them, to do wellness calls for people, to find out if they're okay. Do they need anything else? So we do turn around and come back to folks that we serve to see if they still need assistance in any way. So you can certainly go on our website because there's a volunteer component there, and you can email us through there, or I can put my email up, which is swashington@lifestylesofmd.org, and just say I'm ready to volunteer, Adrienne, and I will welcome you myself.
So thank you so much.
Yes, ma'am.
So we have a lot of students here present tonight. Anytime you need volunteers, call me directly and we will be there. The Human Services, we love you and we know how much you work, and we want to support your organization, and we will continue to do so. And really thank you for this opportunity being here tonight.
I thank you. I hope the noise, I think there's a church upstairs and they're starting their service. So
That's okay.
that may penetrate this, but this has been a pleasure. I hope it's been enlightening. And I hope in some of this that I've been able to share with you, especially my passion for serving this population. There is so much work to be done. And I believe that every one of us has something that we can give back personally. Our personal experience, something that we say or do is going to change somebody's life. I believe that with all my heart. And so just look for the opportunity. I'm here. Thank you.
You have about 110 thank yous for your commitment and everything that you do. And a whole bunch of people want to volunteer and donate, which is a good thing.
Thank
We
you.
have a lot of churches that are here tonight. We have a whole bunch of people in the substance abuse community, and a lot of people that are working in the community as you are. So you will see them very soon.
Thank you so much.
Thank you, Sandy. All right, guys, have a good night. Thank you. Bye-bye.